News release. Thursday, August 17, 2023. Initiative to support research to reduce pregnancy-related complications and deaths and promote maternal health equity. The National Institutes of Health has awarded $4 million in first-year funding to establish maternal health research centers of excellence. Part of National Institute of Health's implementing a maternal health and pregnancy outcomes vision for everyone IMPROVE initiative, the centers will develop and evaluate innovative approaches to reduce pregnancy-related complications and deaths and promote maternal health equity. The grants are expected to last 7 years and total an estimated $68 million, pending the availability of funds. Compared to other high-income countries, the United States has a high rate of maternal deaths, with more than 1,200 such deaths occurring in 2021, the most recent year for which data are available. Each year, tens of thousands more Americans experience severe pregnancy-related complications, which can raise the risk of future health concerns, including high blood pressure, diabetes, and mental health conditions. There are stark disparities in these maternal health outcomes by racial and ethnic group, age, education, socioeconomic status, and geographic region. The magnitude and persistence of maternal health disparities in the United States underscore the need for research to identify evidence-based solutions to promote health equity and improve outcomes nationwide, says Diana W. Bianchi, MD, Director of National Institute of Health's Eunice Kennedy Shriver National Institute of Child Health and Human Development, NICHD. Through collaborations with community partners and others, the Maternal Health Research Centers of Excellence will generate critical scientific evidence to help guide clinical care and reduce health disparities during and after pregnancy. NICHD, the National Institute of Health Office of Research on Women's Health and the National Institute of Nursing Research co-lead the IMPROVE initiative with involvement from several other components at National Institute of Health. The centers of excellence include 10 research centers, a data innovation and coordinating hub, and an implementation science hub. Together, these institutions will work to design and implement research projects to address the biological, behavioral, environmental, sociocultural, and structural factors that affect pregnancy-related complications and deaths. They will focus on populations that experience health disparities, including racial and ethnic minorities, socioeconomically disadvantaged populations, those living in underserved rural areas, sexual and gender minority populations, and people with disabilities. Research centers will partner with community collaborators, such as state and local public health agencies, community health centers, and faith-based organizations. Additionally, the research centers will support training and professional development of maternal health researchers, including those from backgrounds underrepresented in the biomedical research workforce. Funding for the centers was awarded after a competitive peer review process. The following institutions, listed alphabetically along with project name and contact principal investigator, will participate as research centers. Johns Hopkins University, Baltimore, will serve as the Data Innovation and Coordinating Hub. Led by Principal Investigator Andrea Kringa, MD, PhD, this hub will support data collection, ensure high data quality, and provide data science expertise. The University of Pennsylvania, Philadelphia, will serve as the Implementation Science Hub. Under the direction of Principal Investigator Megan Brooks, Lane Fall, MD, this hub will help to promote the integration of research findings and evidence into public health, clinical practice, and community settings. About the Eunice Kennedy Shriver National Institute of Child Health and Human Development, NICHD, ICHD leads research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. For more information, visit https://www.nisht.gov. About the National Institutes of Health. National Institute of Health. National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nagov. National Institute of Health, turning discovery into health registered.